Hi, my name is Kyle Kirschner. This presentation is for a project for an anatomy class for Rasmussen College Winter Quarter 2015, Structure and Function of the Human Body. We're going to be discussing primary progressive aphasia, which I'll refer to as PPA, as well as frontal temporal lobar degeneration, which I'll refer to as FTLD. So we'll start out with the pathology of PPA and FTLD. What is FTLD? Well, it's any degeneration or atrophy of the frontal temporal lobes. Atrophy is the dying of brain cells, of neuron cells. PPA is a specific origin of where this atrophy has occurred within the brain. Now, with PPA, the atrophy occurs in the Broca's area of the brain. Now, as this atrophy continues to progress within the patient will then begin to suffer from frontal temporal dementia. We'll discuss some of the symptoms and effects of PPA and FTLD, as well as the life expectancy of any patient who unfortunately suffers from it. We need to start out by giving you an idea of where this atrophy is occurring. Well, it's occurring in Broca's area of the brain. So just above the temporal lobe and on the lower end of the frontal lobe. This occurs on the left-hand side of the human brain. Broca's area controls speech formation and muscle control for language. So if you have atrophy of this, you can no longer find words. Your word forming becomes difficult, and it leads to a greater language loss, both written and spoken word, as the pathology continues. There are some similarities to it from Alzheimer's. Many times it's misdiagnosed as Alzheimer's. Now the atrophy is occurring in the frontal temporal lobe for PPA and FTLD, whereas the atrophy of Alzheimer's is occurring in the occipital lobe. Similar in nature as far as how the atrophy occurs, just different locations. Now, what causes FTLD? According to Northwestern University Feinberg School of Medicine, FTLD in most cases is caused by tauopathies. A tauopathy occurs when tau proteins within the brain become defective and fail to stabilize the components that they're supposed to adequately in the cell. But to understand what a tauopathy is, you first have to understand what the tau protein is. Tau is a phosphoprotein that's created naturally in the DNA and RNA strands located within the neuron cell. Neurons are eukaryotic cells. They have a defining membrane structure that forms in rigid tracts. So you can see this rigid track of the axon of the neuron. So tau protein is created in the DNA and RNA, which is located within the nucleus of a cell. It is then transported to the distal portion of the axon, where the majority of the microtubules of the cell have formed to create that long cylindrical path, as neurons are used as the communicators to carry information away from the body. So what happens is these tau proteins that are created in the nucleus, they are then transported down the neuron where they form along the microtubules of the axon. You can see the microtubule is the long cylindrical style portion of the cell, and you can see in the upper left portion here exactly how the tau protein sinks itself within the microtubule, allowing it to hold that round, rigid, cylindrical structure that makes up the axon of the neuron. They provide structure and they allow for the shape. Well, what ends up happening in a tauopathy is as the tau proteins are brought down the microtubule, a mutation occurs. Now this mutation, it's still unknown as to what causes it. But what it does is it forces the microtubule to no longer bond, or excuse me, it forces the tau protein to no longer bond with the microtubule. They all then clump together to form this tangle of tau protein that's built up. Now, over time, these tangles end up affecting the homeostasis of the cell and forcing the atrophy of the cell or the death of it. Unlike the nerve cells of the peripheral nervous system, the neurons of the brain do not have the ability to regenerate or repair themselves. So once the atrophy has occurred and the cell dies, it's dead forever. So you saw the clumping and the formation of these tau proteins into tangles. That process is known as hyperphosphorylation, and that is the clumping and the eventual dying of the nerve cell itself. Now, as these nerve cells are dying or causing this brain atrophy, that's what begins to start the symptom onset of primary progressive aphasia. These neurofibrillary tangles are occurring in that frontal temporal region within the Broca's area, causing these speech-related and language symptoms. Stepping on, you can see here on the left-hand side, you can see the healthy brain tissue where no tauopathies have occurred, and then the one on the right-hand side here, the brownish area, that's where these neurofibrillar tangles have occurred, causing these dead brain cells. On the left is the brain tissue under a microscope, and you can clearly see the tangles that have occurred because of the tauopathy, and then the atrophy that occurred to the brain because of that. Now, there's different forms of separate pathologies that occur because of this atrophy. In the case of PPA, it's considered a non-fluent variant PPA, and you can see the red section of the brain there, mainly focused right along that Broca's area. PPA tends to then become semantic and go into the temporal lobe of the brain as additional atrophy occurs. Now, the additional atrophy is occurring because neuron cells are only healthy so long as they can communicate. Once that communication is disrupted, there's lack of homeostasis in more and more neurons. That's when they begin dying off. Some of the symptoms of PPA and FTLD are word-finding hesitations. Because this atrophy is occurring in the area of Broca's area, patients are going to suffer finding words. It becomes very frustrating for them. Many times it's not recognized by a family member because, a lot of times if you think about it, when you're watching your baby grow, you're seeing it every day, whereas it tends to be acknowledged more by coworkers. So jobs become one of the first things that are kind of addressed with primary progressive aphasia. There's a lot of confusion and personality changes. Like I said, this is very gradual. The average onset age is between 45 and 62 years old. It's a relatively young age to suffer a brain pathology. As the atrophy continues, symptoms are going to move from your speech into your written word. This is where it becomes very difficult to communicate. A lot of people end up suffering depression, and in many times it is during this depression period that the PPA diagnosis and the FTLD diagnosis are actually brought forth to the patient. There's little you can do. You cannot stop the continued atrophy. Like I said before, the reasons for the tau proteins mutating is still unknown to doctors in modern medicine. Common treatment paths are speech therapy, beginning to use visual aids, and honestly to begin long-term care planning. Because of the inability to stop the atrophy, the primary treatment method for those suffering from PPA is to try and improve their ability to communicate through these options. But even progress gained in therapy will degenerate as well as the disease progresses. One of the most depressing aspects of this pathology is the onset age. This is typically when a patient's at the peak of their working career or near retirement. In many cases, this person's not emotionally or financially prepared to stop working. Knowing the nature and the degenerative nature of this disease can cause a lot of anger and denial, leading to many depression and anxiety issues. Any medications prescribed during this time period are really just to control this anxiety or this depression of this pathology that is going to take over your brain. This next slide is actually my family. You can see my stepmother Terry here in the summer of 2009, 2 months after she was diagnosed with primary progressive aphasia, and moving on until the summer of 2014 where we were at the Walk to End Alzheimer's in Minneapolis. You can see her physical condition is severely degraded. So she's beginning to show the signs of FTD, or frontal temporal dementia. You can see here the diagram here with the white healthy brain with very active neuron cells. This is the onset stage of primary progressive aphasia, where many tangles have begun to form due to the tauopathies, and then moving forward into the full-blown frontal temporal dementia stage, where you can see there's very little active neurons, mostly all atrophy caused by the tauopathies. The left diagram shows the degeneration difference between a normal brain and a brain suffering from frontal temporal lobar degeneration. With the dementia onset and symptoms, after a PPA or FTLD diagnosis, it's usually noted between 4 and 6 years when the dementia symptoms begin to present. You'll notice a severe physical decline in coordination and muscle issues. They become very difficult to perform daily tasks, putting on a jacket, tying shoes. All those normal everyday functions go away. Behavioral issues such as repetitiveness, clock watching, pacing, lack of empathy. This is all due to the complete communication disconnect that this person ends up suffering. A lot of paranoia, hallucinations, and personal hygiene issues. Issues such as incontinence. We had to remove all of the mirrors in our house at the time as Terry began speaking to him, believing that it was another person. This all leads to advanced 24/7 care, which is very difficult because of the onset age. Between the ages of 48 and 62, these people are not prepared to go into a nursing home and receive 24-hour care. Federal monies are not available as Medicare does not kick in until you're 65. Research and treatment. Doctors have located biomarkers in cerebral spinal fluid, and they're able to identify the tau protein's locations. They don't know why the mutations are occurring, but the hope is that in the future they can find a way to cause an interruption of the hyperphosphorylation or the tauopathies occurring with the neurofibrillar tangles. There's an estimated 50,000 people diagnosed with PPA or other forms of FTLD each and every year. It's impossible to predict the exact nature and course of a frontal temporal disorder. In recent discoveries, the deficient tau proteins and their connection to PPA and FTLD have led to therapies being tested in the laboratory in animals, but nothing that's been FDA approved as of now. Primary progressive aphasia and other frontal temporal degenerative diseases, they really force loved ones of the patient to watch them slowly fade away and lose the unique personality characteristics that made them who they were. Diagnosis of PPA does little to slow the progression and only provides its victims with an insight of what will one day occur. As a family member of a diagnosed individual, watching the progression occur uninhibited and certainly not deserved, it's amazing how this all comes from a single neuron cell. Thank you for listening. Feel free to email me with any questions you might have about PPA or FTLD.